In this video, I'm going to show you how to stop vertigo in 30 seconds. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. As somebody that has personally dealt with this before, I want to show you exercises that I've used to get both quick and long-lasting relief for BPPV, or benign paroxysmal positional vertigo. If you're unfamiliar with BPPV, it's a type of vertigo that is commonly seen with quick movements of the head, especially while turning the head just like this. A common cause is because of an inner ear problem, where crystals within that ear canal become dislodged and affect nearby balance receptors. When this happens, it causes a lot of issues that are not fun, including sensations of being unsteady or unbalanced, to more severe conditions like spinning, nausea, and extreme motion sickness. So to help fix this, I'm going to show easy exercises. Each one of these exercises work just a little bit differently. So to get the best results, go through them all and use what gives you the most relief. As a bonus, all of the exercises can be done at home, require no special equipment, and you may find give quick vertigo relief even within 30 seconds. So with that being said, let's get started. So let's start by answering the most important question. What ear, what side is causing my vertigo? A really easy way to tell is to lie flat on your back in bed and just simply roll over to one side. Whatever side that you roll over that causes more spinning, nausea, vertigo tends to be the side that you're having an inner ear issue. But if you're unsure, my best advice is to consult with your local doctor. Also, if you're unsure if you even have BPPV, I would get it checked out. When in doubt, always get it checked out. Another note about these exercises, through personal experience, I can tell you that it is very common that you will get an increase of vertigo, including nausea and sickness while doing these exercises. So if that's the case, have a bucket or trash can nearby just in case. But you should notice through repetitions that you get more relief, and hopefully that won't be the case. This is the half somersault or the Foster maneuver, and this one has helped me out quite a bit in the past with vertigo. It's my go-to exercise. I'm going to go through different positions and movements. Each movement you want to hold until all spinning stops, including any nystagmus, that twitching motion with your eyes, plus 20 to 30 seconds after. So the first position, we're going to be on our knees and we're going to look upward towards the ceiling as much as we can. The next position, we're going to put our hands in front of us just like this and then do a quick somersault forward, bringing our head towards the floor. Let's also tuck our chin towards our chest. The position after this is maintaining that chin tuck, but turning our head 45 degrees towards the affected side. So I'm showing it on my left side. An easy way to get into position, just look towards that side's elbow or armpit. And then from there, we're going to maintain this chin tuck and also looking 45 degrees over, but we're going to lift our head up like this very quickly. It's very important to do these movements quickly because that will help reset the crystals. From there, we're going to come upright like this, maintaining that chin tuck and looking 45 degrees towards the affected side. And then the final position is just taking our neck back into a neutral position, just like this. But again, go through all of those positions, hold them until all spinning stops, plus 20 to 30 seconds. With my personal experience with this exercise, I've had to do it pretty much throughout the day, sometimes every 10 to 15 minutes. And then what I'll notice is that it helps build over time, where I only have to do it maybe once an hour, every couple hours, to only a couple times a day to a couple times a week. So it builds upon itself, and keep working at it. This is the Brandt-Daroff maneuver, or what I like to call the couch method, because it's perfectly done at the edge of a couch or a bed. We're going to start off lying on one side. Doesn't matter what side, because we're going to do it on both. I'm going to start on my left. So I'm just going to keep my body in a nice straight line and then bring my shoulder down like this, and let's swing our legs so they're resting on that couch or the bed. From here, I'm going to turn my head 45 degrees to look towards the other side shoulder. So in this case, I'm turning to look over my right shoulder. An easy way to get in the right position, let's say that looking straight ahead is 0, and if we were to turn all the way over to look towards our shoulder, that would be roughly 90 degrees. So we just need to meet right in the middle. So our nose is slightly pointing upward towards the ceiling. In my personal experience, this exercise can quickly worsen vertigo symptoms, including nausea and spinning. So if that's the case with you, do not be discouraged, because through repetitions, you'll probably notice that this exercise really will help lessen those symptoms, if not completely get rid of them. You want to hold this one for 30 seconds, but if you have really bad symptoms, do the best you can, and through repetitions build into it. From there, we're going to come back up like this and just look straight ahead. You want to, again, hold this one for 30 seconds or until all vertigo symptoms go away. And then we're just going to repeat it on the other side. So I'm going to come down on my right side, and then I'm just going to look 45 degrees towards my left shoulder. You want to do this one for 5 repetitions on both sides. And again, hopefully with each repetition, what you're going to notice is those symptoms become less and less, and hopefully just go away completely. Again, in my personal experience, I had the best results doing this exercise a couple times throughout the day. This is the Epley Maneuver, which is arguably the most popular and widely used exercise for treating BPPV. This one is best done in bed. Just make sure to grab a pillow to place underneath your shoulder blades. So a couple notes about the Epley before we begin. With this exercise, you want to do quick movements. It makes it more likely that you'll reset any loose crystals in your ears, giving relief. Next, we're going to go over a couple different positions. Each position you want to hold until all spinning stops, plus an additional 20 to 30 seconds. So let's start off by positioning our pillow where it's going to rest right over our shoulder blades, but our head can come back just like this. What you want to do is come back up like this, and you're going to turn your head 45 degrees quickly towards the affected side. In this case would be my left side. If you're unsure what 45 degrees looks like, if you were to turn your head all the way over to look towards your shoulder, that would be roughly 90 degrees. So back off about halfway. You're going to hold this position and now quickly come down like this, bringing your head down to rest on the bed. Our next position is very similar. We're just going to quickly turn to look over the other side's shoulder. So in this case, I'm going towards my right. The position after this, we're going to maintain this 45-degree turn, but we're going to quickly roll over on this other side shoulder, just like this. So my chin and my head are slightly pointed down towards the floor. From here, we're going to quickly come up like this and rest right at the edge of the bed, have very good upright posture, and just look straight ahead. You want to hold this position until all symptoms, including spinning and nausea, have stopped. And for good measure, I would recommend holding this for an additional 60 seconds, just to allow the ears to reset. The Epley you can do a couple times a day, and it is really good at giving quick BPPV relief. This is the BBQ Roll. I can't say it's overly tasty, but it is really convenient because we can do this one right in bed. So just grab a pillow for this. I'm going to go through different positions. Each position we want to hold until all spinning goes away, plus an additional 20 to 30 seconds. So let's start off by just getting into position. I'm going to lie flat on my back and have my neck supported by the pillow. The first position, we're going to roll over on the affected side. So in this case would be my left side. Again, my neck is going to be nice and straight, supported on this pillow, nose pointed straight ahead. The next position is just lying flat on our back, just like this. The next position after this is rolling over towards the other side. The next position, we're then going to do our roll. So let's roll down, I should say roll over like this, so our head is pointed down. You can support your upper body weight on your forearms. They're kind of in a V position. I put my hands together, and then you tuck your chin towards your chest. The final position after this is then just rolling back onto the affected side and then holding this position. Afterwards, just come back up like this and see how you feel. You just kind of want to look straight ahead and sit here until all symptoms go away for an additional 20 to 30 seconds. In my personal experience with the BBQ Roll, I've had to do it a couple times before I really noticed some really good results. So build into it. And this one is perfect to do a couple times throughout the day, maybe first thing in the morning when you wake up and right before you go to bed. If the exercises helped, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.